You know, there's this feeling you get when you walk through the doors of a hospital. It's a place of incredible hope, but also, let's be honest, a place of real vulnerability. You're putting your trust, maybe even your life, in the hands of people you've just met. But here's the thing. That trust isn't just a blind leap of faith. It's actually built on a foundation you probably never even see.
So, I've got a question for you. When you walk into a hospital, how do you really know it's safe? How do you know the equipment is working right, that the staff are actually qualified, or that there are systems in place to keep mistakes from happening? It's a huge question we rarely stop to ask, but the answer, well, it's all around you.
You might see a seal like this one from GAHAR, the General Authority for Healthcare Accreditation and Regulation. Now, that's not just some fancy logo they slap on the door. It's the visible tip of the iceberg. It's a sign of a massive, hidden system of checks and balances, all designed for one single purpose: to keep you safe. So today, we're going to pull back the curtain and see what that promise of safety is all about.
So, what even is accreditation? Okay, think of it like this. It's a massive, top-to-bottom quality inspection for the entire hospital. It's a formal process where an independent group, like GAHAR, sends in a team of experts to meticulously check if the hospital is meeting hundreds, sometimes thousands, of super-specific standards for safety and quality.
And this quote from their handbook, it really gets to the heart of it. This whole thing isn't about ticking boxes or filling out paperwork. It's a mission. Every single rule, every standard is there to back up this promise of quality, of safety, and of putting you, the patient, right at the center of it all.
To really get a feel for how this works in the real world, let's follow a patient on their journey. From the second they arrive, that unseen shield of accreditation is already up and running, starting with the absolute basics.
Before any test is run, before any medication is given, the very first safety check is making sure they are treating the right person. It sounds so simple, right? But accredited hospitals have to have a super robust way of identifying patients. Getting this step right prevents a whole cascade of potential mistakes. It's the first and maybe most critical link in the entire chain of safe care.
And from that very first moment, you also have fundamental rights. Accreditation standards make sure these aren't just nice ideas. They have to be baked into the hospital's day-to-day operations. You have the right to be informed, the right to refuse treatment, the right to have your pain managed, and even the right to know the name of every person treating you. These rules are there to empower you, to make you a partner in your own healthcare.
This system is also designed to see you as an individual, not just a case number. Standards require that a full medical and nursing assessment has to be done within 24 hours of you being admitted. And this isn't just a formality. It's all about creating a personalized care plan that's tailored to your specific condition and your needs, right from the get-go.
Okay, now let's move to a more critical moment in our patient's journey. Let's say they need a procedure. This is where the stakes are higher, and those safety nets woven by accreditation, well, they become even more crucial.
Before anything happens, there's a process called informed consent, and the standards make sure this is way more than just you signing a form. It has to be a real conversation. The medical team has to explain the procedure, the potential risks, the benefits, and what the alternatives are. It's all about making sure you have all the info you need to make the right decision for you.
And this is just a brilliant example of how systems can prevent human error. Inspired by things like the World Health Organization's surgical safety checklist, accredited hospitals use these systematic pauses or timeouts. Before anesthesia, before the first cut, and before the patient leaves the operating room, the entire team just stops. They pause to confirm all the critical info together. It's a simple, powerful tool that has been proven to dramatically reduce complications.
You know, one of the biggest causes of medical errors is simple miscommunication. That's why accreditation standards enforce a really simple but powerful rule for any orders given over the phone or verbally. The person who gets the order has to write it down, read it back to the person who gave it, and then get confirmation. This little read-back loop is designed to catch any misunderstanding before it can cause any harm.
And before any new medicine ever gets to our patient, another unseen shield is at work. Accreditation requires that a pharmacist reviews the order for appropriateness. They're checking for the right dose, looking for potential allergies, and making sure it won't have a bad interaction with other drugs you're taking. It's a vital safety check that happens completely behind the scenes.
So, while our patient is resting and recovering, let's pull that curtain back even further. The hands-on care they're getting is supported by this huge infrastructure of safety systems, stuff they'll probably never see, but that is constantly protecting them.
The GAHAR handbook is essentially a blueprint for building a safe hospital.
It covers everything. I mean, it looks at safety from every possible angle, from what the patient experiences to how the whole organization is run. It covers managing the workforce, making sure the building itself is safe, and of course, a massive focus on preventing infections. It's a total 360-degree approach to safety.
So how do you know the nurse or doctor taking care of you is any good? Well, the accreditation standards for managing the workforce are incredibly strict. The hospital has to verify every single credential right from the source. They have to document that staff are competent in their specific jobs, and they have to do regular performance reviews.
And what about the building itself? The standards for the facility and the environment cover the whole physical space. This means making sure there's reliable power and clean water, that all the medical gear is tested and maintained regularly, and that there are detailed plans for emergencies like a fire or a natural disaster. It's the safety net that protects absolutely everyone inside. And just to show you the incredible level of detail we're talking about, there are even standards for laundry. Yes, laundry. There are specific rules for how to handle contaminated linens, the right water temperatures for washing, and how clean sheets are stored, all of it designed to stop the spread of infection. It just goes to show you, in a truly safe hospital, no detail is too small.
Okay, let's get back to our patient. They're feeling better, they're ready to go home. The very same system that protected them inside the hospital is now focused on making sure they have a safe transition back to their life.
The last crucial piece of communication is the discharge summary. Accreditation standards spell out exactly what has to be in this document. Think of it as your personal roadmap to recovery. It clearly explains why you are in the hospital, what medications to take, and what follow-up you need. This makes sure that you, your family, and your regular doctor are all on the same page for a smooth recovery.
This quote from the handbook, it just sums up the entire philosophy perfectly. Patient safety isn't just a nice goal to have. It's the unwavering pillar that everything else is built on. It's the central idea that organizes every department, every process, and every single action inside that hospital. So here's the big takeaway. Your safety in a hospital isn't left to chance. It's not just about hoping you get good doctors and nurses. It's the result of a meticulously designed system that is constantly being checked and improved, creating an environment where those skilled professionals can do their best and safest work. Now that you know what's going on behind the scenes, you've got a whole new way of looking at things. You'll see that patient ID bracelet not as just a piece of plastic, but as the first link in a chain of safety. You'll understand that pause before a procedure is a life-saving ritual. So my question to you is, the next time you're in a hospital, what unseen shields are you going to notice?